so that we will have it available for folks later. So as I was saying about the NMCS Travel Award, Division 18 members are welcome to apply for this biennial award and to receive funding to attend and present at NMCS. And the next conference is going to be held at 2021. So please keep an eye out from our committee for a call for applications that should be coming in late 2020. Just a few housekeeping items that I'd like to keep folks reminded of, and they are located in the notes pod right here to the right of your presentations, to the right of the slides. Please make sure to log in with your full first and last name. I see most folks have logged in with their full first and last name, but some people are using initials or first names. So please make sure to log in using your full first and last name if you are requesting CE credits so that we can confirm your attendance after the webinar, especially if you, for those folks who have registered in advance, because that will allow you to be eligible for the one free CE credit or the $15 CE credit if you're not a division member. The Q&A box, which is located in the bottom right of your screen, should be used to share any questions for the presenters, and I will moderate a little bit towards the end. They'll be addressed at the conclusion of Dr. Gregg's presentation. After today's webinar, registered participants will be sent a follow-up email with instructions for claiming CE credits, and if you are not a member of Division 18 and wish to obtain CEs, you can do so for $15. We'll send out a link for a PayPal where you can submit your money. And finally, for more information on the Diversity Committee for Division 18, please visit our website. The URL is located in the notes box. We are always eager to welcome new members from throughout the division. It's not specific to one particular section. And we look forward to welcoming members from all stages of career and student training backgrounds as well. So without further ado, I would like to now formally introduce Dr. Gregg. I'm going to read a brief bio that she submitted. Dr. Astria Gregg is an alumni of New York University and University of Hartford. She completed her predoctoral internship at Yale, Connecticut Mental Health Center, and her postdoctoral fellowship at the Bedford VA Medical Center. She is currently at Cambridge Health Alliance, working in primary care behavioral health integration in the Boston metro area. Prior to CHA, she was at Boston Healthcare for the Homeless in Massachusetts General Hospital and worked in primary care clinics for underserved persons experiencing homelessness and housing instability. She also helped build new behavioral health and substance use service programs in shelters and supported housing programs. She is committed to meeting the needs of diverse populations and is co-chair of the American Psychological Association's Psychologists in Public Service Division 18 Diversity Committee. She's also on the task force to develop APA guidelines for persons with low income and economic marginalization. Dr. Gregg is an assistant program chair of APA's Society for the Advancement of Psychotherapy, which is Division 29, and she is interested in diversity and discrimination, serious mental illness, and primary care behavioral health integration. So without further ado, I'd like to turn the mic over to Dr. Gregg.
Thank you so much, Valine. Can everyone hear me okay? Okay, great. I'm hearing some yeses. So why don't we get started? So as Valine mentioned, the topic today is Set Up for Poverty, the intersection of low income and discrimination. And so just for a quick agenda of what we'll be talking about today, we'll be talking about poverty, but in the context of race and ethnicity, LGBTQ populations and ability, and also homelessness in these contexts as well. And, you know, some people might be asking, why am I focusing on homelessness? Well, really, we can't really talk much about poverty without addressing homelessness. And really, all these things point to intersectionality and how we'll talk soon about how these are so intertwined. We'll finally end with an improved conceptualization of pathways to poverty and homelessness, focusing on this intersectionality lens. And so what is intersectionality? It's really the concept that race, class, gender, ability, every aspect of someone's identity is interrelated, that no one aspect of someone's identity exists solely independently in a vacuum. This is a term first coined by Kimberly Williams Crenshaw, and it's an analytic framework that attempts to identify how interlocking systems of power impact those who are most marginalized in society. I quite like that description. Okay, so we'll be talking and focusing on socioeconomic status. And so this is a lesser talked about aspect of diversity. It's often kind of overlooked or not as talked about when we talk about multiculturalism and diversity in various aspects. It's sometimes visible and sometimes not. It affects our mental health, our physical health. It affects our social capital, resources, opportunities. In fact, it affects all aspects of a person's life. And so what's really interesting, I just mentioned just now that sometimes it's visible and sometimes it's not. And that's because poverty can go away, right? That it's something that isn't permanent, that we can kind of enter and leave poverty. And so it's really interesting that there's been some research that shows that childhood poverty actually contributes to increased risk of adult mental health symptoms later on when they're adults. And the way by which this happens is actually brain development is altered. They found Jovenbach and colleagues in their recent published study here. And so there's brain development that's altered actually after having had an experience of childhood poverty. And so what they found is that persons who've had childhood poverty were more reactive to fearful faces as adults. And so here in the scatter plot here, let me get out a pointer here. Hopefully what I could highlight here is that how the red line here shows that persons who have experienced poverty by the lower numbers here on this family income to need ratio here, and the persons with more poverty have higher reactivity in their amygdala to fearful faces, more so than persons who did not have childhood poverty. And so there's this really fascinating biological difference in persons experiencing childhood poverty. And so what does that make you think of? Well, that makes me think of ACEs, or childhood or adverse childhood experiences. And so many people should be familiar with this. Adverse childhood experiences are children who've experienced physical or sexual abuse or neglect, children whose parents have a substance use disorder, who've been incarcerated, children who witness intimate partner violence, divorce, and separation. And so what happens is that these adverse childhood experiences, as you can see with the blue bottom of the pyramid here, contribute later on in life to social and emotional and cognitive impairment. And right, so the study that I just had mentioned definitely contributes to the cognitive impairment and also the emotional and social part. But then this kind of trickles up later in their lives to adoption of increased risk, health risk behaviors, disease, disability, social problems, and unfortunately early death. What I'm asking here in this presentation is poverty an adverse childhood experience? Is discrimination? And there's been kind of early research from researchers who have talked about how discrimination can definitely be an ACE. And there's one here that I have mentioned that looked at maternal racism and how this correlates with low birth weight. So here again, there's some biological, tangible outcomes of racism. It's kind of similar to how there's tangible outcomes of poverty. All right, so we talked a bit about how poverty affects children. Now let's talk about how poverty affects adults. So there's some really interesting studies recently done by psychologists who have teamed up with behavioral economists. And so this really interesting study looked at poverty in persons. They went to a very large mall in New Jersey that has really kind of the whole continuum of socioeconomic classes. And what they did was they gave people fake money for this experimental study and had some people in a poverty condition and some others not, and gave them cognitive and neuropsychological measures. The persons that were in the fake poor condition, the fake poor group, actually did more poorly on these measures of cognitive ability than the persons who were not deemed poor, which is really interesting because these are just people who are poor now as adults. Also, what they did was a naturalistic study among farmers in India. And what they had kind of naturally seen is that farmers in India, whenever they first, have all their crops at the end of their growing season, and then finally sell their crops, in their communities, they have a lot more money at that time of the year, and measured then their cognitive performance during this time when they were kind of relatively wealthy to themselves. Then later, right before the next time that crops were kind of collected again for selling. So right before that time when their money, a year later has really kind of thinned out, they also measured their cognitive performance again and saw that their performance was actually a lot less during their time of poverty relative to themselves than when they were relatively wealthy. So even temporary poverty has been shown to affect our cognitive performance. All right. And so then what happens if we have poverty go away? And so studies show that when poverty goes away, our actually psychological distress decreases as income increases. And so what we'll see here is that persons who are at or less than 100% of the federal poverty level have more psychological distress than persons who are 4 times the amount of the federal poverty level, who are way over the poverty level, have way less psychological distress. What's also very interesting in this study by Weissman and colleagues is that there was significant differences between persons of color and non-persons of colors, and persons with a white or non-Hispanic background had less of an impact than those who were not. All right, so that's a nice segue into our talking about impoverished communities. So poor communities are more likely to have women, children, people of color, persons who identify as LBGT, and also a bullet point that I'm missing here are people who are disabled or differently abled. And that is because there are less resources in these poor communities than non-poor communities. And as I talked about earlier, there's less of a social, physical, educational, economic capital for these communities. There was a recent, really thorough examination by APA in there was a report called the Stress and Health Disparities Report, and they talk a lot about the intersection between race and ethnicity and health disparities and class. And so this is a nice diagram that I pulled from their report that shows how race and ethnicity and social class up here both contribute to increased threat exposure and gaps in resources, and then that increased overall stress exposure. Some people might be thinking, well, why is harsh parenting here? That might seem a little biased. It has nothing to do with someone's race or ethnicity background, but rather, again, this lack of resources, that if you're working 3 jobs and if then you are, taking public transportation and having to do this and having to do that, the amount of stress that is accumulated for yourself is detrimental, is not sustainable. And that can unfortunately kind of come out in our child rearing and make it so that we have less time and less ability to devote to different things in our lives, like our child rearing. And that kind of speaks to how our own, adversity, our own perhaps ACEs can contribute to the next generations, which I'll touch on later. All right, and this is just another graph to highlight the really important intersection between backgrounds such as race, poverty, and your environment. This is pulled from a health inequity study that I think was from a pediatrics journal. And basically, again, it just shows how our social environment, our built environment, which they refer to as kind of like the structure, the organization of the place where you live, and our demographics are really intertwined. Okay, so now let's move into poverty and race. This diagram here, this bar chart here, shows how persons who have more poverty, so this is going up here, where persons with the highest amount of poverty have a very different stratification here of race than the persons perhaps down here, and there's kind of this downward pattern here. And so I know it's kind of hard to see with these varying shades of gray, but persons with the darkest shade of gray are white non-Hispanic persons. And as you can see on the side here, the other shades of gray, the key shows here. And so basically, the higher the poverty level, the more people of color there are, and the less persons who are white non-Hispanic there are. And this, I believe, is done with a national data set as well. All right, so let's briefly also talk about poverty in LGBTQ populations. During childhood, there's an increase, and this is something that's really well known in the literature, is that there is an increase in conflicts in family. And this has a lot to do with persons who are coming out and kind of difficulty navigating this in the context of their family dynamic. And so there's a lot of young LGBTQ folks who leave home early and who enter the child welfare system early. And also for transgender folks, there's a significant amount of this population, transgender youth in particular, who are kicked out of their homes, which is 33%. And let's talk more about poverty and ability. So persons who are differently abled also experience poverty more than persons without. And there's been some recent studies that show that 2/3 of persons with disabilities are unemployed versus persons who are not with disabilities. All right, so now we're going to move on to homelessness. And I'm just going to, now with that kind of history of poverty and also race, ethnicity, LGBTQ folks, and ability, we're going to kind of keep that on hold in our minds, and we'll talk about homelessness and kind of bring it all back together in the end here. And I'm just going to talk a little bit about homelessness in general first. So about 500,000 of persons are homeless in the United States in any given year. And there's an annual count. And so in 2018, this was the number that they found. And homelessness can mean quite a few things. And homeless people can be sheltered or unsheltered. So people can live sheltered in housing, supported housing, whether permanent or not permanent. Shelters is an example of non-permanent housing. And also people who are homeless can also be unsheltered, living in streets and cars and other various places that are not suitable for human conditions, human living. And there's many well-known pathways to homelessness. And in the literature here, there's a lot of research on how serious mental illness, substance use, and intimate partner violence really can contribute to homelessness. In the state of Massachusetts, where I'm based, these three, SMI, substance use, and intimate partner violence, are the three main reasons why families end up homeless in the state of Massachusetts. And what's really less researched are adverse childhood experiences, just poverty in general, and a lack of affordable housing. But there definitely is literature on this. It's just kind of less of it. All right, so now let's talk about homelessness and ACEs. So childhood trauma is correlated with later experiencing homelessness as a child. And adults with ACEs are more prevalent among homeless parents than non-homeless parents. In fact, what has been found is that over 80% of homeless parents have experienced at least one adverse childhood experience. And almost 50% of these homeless parents have 4 or more adverse childhood experiences. And what I touched on before with this kind of intergenerational adverse childhood experience is that parents with homelessness and adverse childhood experiences are more likely to have children who have adverse childhood experiences. Okay, so now let's segue into homelessness and race. African Americans are truly overrepresented in the American US homeless population. 40% of our US homeless population identifies as Black or African American. Yet, only 13% of our US population from census data is African American or Black. And that is a huge discrepancy, a huge mismatch there. Let's talk further about race. 22% of the homeless population identifies as Latina, Latino, Latinx, which is actually kind of near the actual US population of 18%. However, a lot of folks believe that this is likely an underreported number, often due to immigration status and fear of the legal system, that this number of homeless Latinx people should be perhaps a lot higher, people think. All right, and this is further data from this national yearly count of homeless persons across the United States and just kind of goes over different demographics and homelessness, whether people are sheltered and unsheltered. And you can see here race and ethnicity and gender and age. Okay, now let's talk about youth and homelessness. Half of homeless youth in the kind of surveys that we do in these national data sets have a foster system history. And unfortunately, 60% of these youth report being in the child welfare system due to abuse or neglect. And talking about adverse childhood experiences, over half had had a parent who was incarcerated. And what's been found is that caretaker physical abuse, so whoever the child's caretaker was, predicts youth sexual abuse on the street. So these were homeless youth who were living on the street. And caretaker sexual abuse predicts youth sexual assault on the street. And so here we can see a very unfortunate continuation of trauma. Okay, now looking at homelessness and LGBTQ, the population there. So pathways to homelessness, as we talked about, is really relevant to being kicked out of your home, kicked out of your family, being in the foster system. But what often then happens, the way that people often become homeless amongst this group is that they age out of the foster system. So after they've been kicked out of their home and enter the foster system, once they turn 18 and age out of the foster system, they really often have no place to go because their family of origin is something that is still shattered and something that is still just not quite, rekindled. And so then they kind of have, talking about resources, less social capital, less, kind of chances to kind of get back on their feet once they turn adult. And so often that's how people from the LGBTQ population will become homeless. So roughly 20% of the homeless population identifies as lesbian, gay, or bisexual, and less are likely to be found in shelters. What's unfortunate is that many are actually likely to be found in strangers' homes. And so this is like through couch surfing and kind of living with persons that they have somehow met. And there are higher pre-homelessness stressors found amongst this population than non-LGBT persons. So as kind of alluded to before, there's an increased experience history of sexual assault, physical assault, and neglect here. And there's been some recent research by Forge and colleagues that I'll highlight. There's also higher mental health concerns amongst homeless LGBT folks than non. And what's really interesting is that amongst gay men, there's a higher prevalence of major depressive disorder. Overall, there's higher amounts of PTSD and suicidal ideation. And amongst women, there's a higher prevalence of substance use. This is kind of interesting because from what we know about substance use prevalence is that this is often seen as to be higher amongst men. But in this kind of subpopulation, it seems to be higher among lesbian women. And what's also really well known amongst this subgroup here is that there's a high amount of survival sex or commercial sexual exploitation that's used as a survival mechanism, right, as a means to get by, to make money, to continue living. And related, there's a high level of sexual assault during homelessness. And so this is just a chart here from a recent Forge and colleagues paper that shows that basically there's a higher amount of these. Here, I'm trying to get my pointer to work here. Come on. I don't think my pointer will work anymore, but basically the highlighted yellow part below will show that there's higher amounts of sexual violence, sex trafficking, and then also trauma while homeless compared to a cisgender population there. What's also interesting to end on with the subgroup on some of more of a positive note is that compared to heterosexual cisgender folks, the LGBTQ homeless folks in this study had a higher amount of adult friends. And so this perhaps can be used, as a strength, as a perhaps ability to kind of connect with this group and to help this group and to forge rapport, with this group into better being able to connect them to services so that they're likely to have adult friends, and we can perhaps use this to their benefit. And of course, there's some limitations on this, that there is reliance on self-report data and no formal measures of mental health or substance use here. Okay, homelessness and ability. This is actually area where there's a bit of a dearth of research. Many homeless persons are differently abled. About 20% have been found to have a learning or developmental disability. And just anecdotally, what's really interesting is that persons who are homeless after they're homeless tend to develop a lot of physiological concerns. What's really common for folks that live on the street is that they often will have really non-treated diabetes and hypertension and all these kind of basic chronic primary care ailments that we'll commonly see in the general public, but the homeless population will have the very very well developed, very severe versions of these common ailments because of their lack of access to treatment, because of their lack of follow-up, because of the lack of services that are, kind of specialized and provided to this population. And so basically what happens is that a lot of people, and this is something that I've seen a lot with working with folks experiencing homelessness, will have lots of leg amputations, vision loss, lots of kind of difficulty ambulating, all because they've had some real serious diabetes. So they've kind of had real late stage diabetes that often aren't kind of seen in normal primary care settings. Okay, now let's talk about homelessness and gender. So about 60% of women experience violence while homeless. And so this is a real common concern that when women are homeless, especially when they're unsheltered, that a lot of women are targeted by strangers and also by people they know. Riley and colleagues did a study and found that actually what happens is that mostly what the population consists of who perpetrate these women are mostly strangers and not people in their family or community. And so this kind of also goes against our general knowledge on the prevalence of sexual assault, that often what happens in the general population is that persons will be perpetrated by people they know, people that they've met before, people in their family or their community. The opposite, in fact, is the case for women who are homeless, that they're often targeted by strangers. And so the researchers here then encourage women who reside on the street to sleep in a place that is unknown to others. This also, unfortunately, then proposes as a difficulty to women who experience homeless, because they'll often actually want to sleep near people they know for safety, to be sure that they are safe. And so this advice goes against the common practice of persons experiencing homelessness, because persons who are living on the street, which are often kind of called rough sleepers for folks who work with this population, that most people will want to sleep near others, friends, acquaintances, as a means to kind of have more numbers and to be safe and not be targeted. Okay, so now we're going to switch gears a little bit and talk about two recent studies that have been done by Gaddis and Larson, I believe at the University in Madison, Wisconsin. And so basically what they were looking at is homelessness, race, and LGBT population. And they had a smaller sample of about 90 Black homeless youth. All were adolescents to early adults and recruited in a drop-in homeless service. They've had to have had at least 7 days of homelessness in the past month. And they were measured for depression, risky behavior, alcohol measure here. They used the racial and LGBT stigma scales of this alcohol measure. And they also used this 12-item homeless stigma scale, which kind of just assesses for their experiences with being stigmatized due to their homeless, identity. And what they found is roughly 43% have slept outside, and 70%, so a lot more than half, had high to moderate to high major depressive symptoms. 30% experienced suicidal ideation. Roughly 14% had a suicide attempt, and half of this group did not identify 100% heterosexual. Also, just to remind folks that if you have any questions during this presentation, please feel free to ask in the Q&A box to the right there, and we'll happily answer as much as we can at the end of the presentation here. Okay, and so this is just a chart from their paper here that shows in the yellow highlighted section that perceived stigma due to their homelessness predicted depressive symptoms, as well as racial discrimination. So discrimination due to being homeless and discrimination due to being in a racial minority group predicted depressive symptoms amongst this group. Okay, so then they actually studied the same population again. And so again, they had about 90 or so Black youth experiencing homelessness, adolescents to early adult, and they changed the measures this time, also looking at LGBT people of color microaggression scale and the racial microaggression scale. And so what they found is that suicidal ideation, racial discrimination, sexual orientation discrimination, and homelessness discrimination all predicted depressive symptoms. So here again in the highlighted sections, we can see how microaggressions related to being in the LGBT population and microaggressions related to being in a racial category, non-white racial category, predicted depressive symptoms. All right, so basically these two studies show evidence for the compounding nature of stresses experienced by persons with multiple marginalized identities, right? So these are people who are racial minorities, sexual minorities, and also low SES, very low SES, they were experiencing homelessness, and how all three of these identities, the intersection perhaps of these identities, contribute to depressive symptoms. There's a few limitations, though, to both of these studies with a small convenience sample focus on young adults, self-report measures, and only identifying Black individuals. Okay, so now we're tying all of this together, our discussion on poverty and stress, how it interferes with our cognitive development, and then talking about poverty and race, ethnicity, with gender, with sexual orientation, with ability, and then talking about homelessness. We're going to bring it all together now, and basically just wanting to highlight that poverty and homelessness is an even more complex issue than perhaps we previously thought. That it's not just related to a lack of money or a lack of housing or just being really unlucky, right? That it's really more complex than that, and then it has to do a lot with these different subpopulations in the U.S. that experience lots of discrimination and stresses. And so perhaps poverty is more tied to race, ethnicity, ability, sexual orientation, and gender identity than is discussed, related to institutional, social, family discrimination, lack of resources and capital, and ACEs. Ooh, unfortunately, a graph is not showing up here. So basically, what I had put here is basically a few bubbles connecting to each other. So basically that the traditional pathways to homelessness, as we know in the literature, is that it's related, like I said, to lack of housing and poverty. And also a lot of the literature, like I discussed, on serious mental illness, substance use, and intimate partner violence. Those are all really well-known correlates of homelessness. And so that's kind of the more traditional view. And then what I had originally had shown here was how we can perhaps update what we know about pathways to homelessness by including race and ethnicity, LGBTQ status and ability. And so I had kind of added new bubbles for these aspects of diversity, aspects of identity into this kind of visual graph of how people enter homelessness. Alrighty, so these are the references that I had, shown throughout the presentation. And
Okay,
thank you very
wonderful.
much.
Thank you so much, Dr. Greg, for presenting this incredibly important and timely topic. I do see where some of the slides didn't show up. I just want to double check to see if you'd like me to circle back around to those. If not, we may be able to send them out with the slides or with the post conference information. Okay, all right. I'm going to take that as a no. All right. Here. All right, so we do have, again, the Q&A box here at the bottom right of the screen. So do please feel free to add a question or a comment that you'd like to share. Microphones are disabled for participants during this presentation, but I am happy to read out any questions or comments. We do have one comment from Dr. Frank who's saying, great informative presentation. Thank you very much. And in the meantime, what I can go ahead and do is I can talk a little bit about some of the initiatives and events that we have coming up. As we mentioned before, we do have a travel grant that Dr. Greg was the first recipient of this year. And it is for the National Multicultural Summit, which happens every other year. So we encourage people to keep an eye out if you are a member of Division 18 or planning to become a member of Division 18 or would like to be in touch with our committee directly for information in support of presenters who will be attending NMCS. And that grant is open to anybody, again, who is a member in any form of the division. Additionally, I want to put in a quick plug for some of the events that we have coming up in Chicago in a few weeks for those of you who will be attending this year's APA convention. In particular, each year our committee hosts a diversity committee open house. It is held in the Division 18 Hospitality Suite, which this year is in the Hyatt Regency. The event is going to be held on Thursday, August 8th at 7 p.m. Anybody and everybody is welcome. You do not necessarily have to be a member of the division, although certainly we would welcome you if you would love to join us in the division. But it's a great place to stop by and to meet members of the committee who have similar interests in diversity in the public sector, as well as to gather with some of your friends and colleagues. I know that 7 p.m. is usually the point when convention is winding down. So if you'd like to stop by and just kind of chill out with your colleagues or grab a quick snack and a glass of wine, we are happy to have you. We will send out more information through the listserv as it becomes available. And we also, each year, as part of the submission for the division's newsletter, the special APA edition, will send out some information highlighting different presentations that have a diversity social justice focus that are affiliated with Division 18. So please do keep an eye out for that as well. And if you do have a presentation that you would like us to highlight, we would love to get that information from you and make sure that your hard work in your presentation at APA in any form is highlighted as well. So it appears at this point that we don't have any questions. So I would just like to double check to see maybe, Dr. Greg, if we could hear a little bit from you about some of the interest that has kind of come about in your presentation, your own background, and how that shaped this presentation that you submitted for the Multicultural Summit.
That's a great question. Thanks for letting me share. So prior to my current position at Cambridge Health Alliance, as Valine mentioned, I was at Boston Healthcare for the Homeless program. And so there, what BCHP is basically a community health center that all of its patient population are folks experiencing homelessness. I don't mean to use the word patient in a derogatory way. That's just what they kind of use to call patients. Similar to clients or consumers. And so basically, in seeing only folks experiencing homelessness and housing disability, I got to see people kind of really throughout the entire continuum of the homeless population. So I worked with people who were housed in permanent supported housing, to people who were living on the street, to people who were in shelters, and people who basically just kind of couch surfed, ad infinitum for months, years, decades, and everyone in between, women, men, people of all sorts of different backgrounds. And identities. And so, yeah, the experience that I had there for 4 years working there really showed me a real, kind of real glimpse of what this population is really like. And so I think we all go into working with different populations sometimes with some preconceptions based on what we've seen in the media or learned in school and throughout our training and our work. And so I really saw the high level of persons of color, persons in the LGBTQ population, many women, tons of experiences with trauma, adversity, and people with disabilities and who are differently abled, and really just showed me how prevalent it was in this population.
Okay, wonderful. Thank you so much for sharing a little bit of that background information. At this
Are there
point,
any?
sorry, go ahead.
Oh, so sorry. Go ahead. I was going to ask, are there any other questions before we have to end for today?
So other than very kind messages, offering well wishes, and expressing appreciation for the presentation, I don't see a question at this time. So at this point, I guess we will go ahead and wind down. As we are coming close to the end of our presentation time for today, and we do want to leave folks with passing time. We appreciate people for attending, the participants for attending today, and for taking time out of a busy work day, for a school day for many folks. Again, I would like to thank Dr. Astria Gregg for offering insight into this important area of her expertise. And I would like to just make sure to, again, thank those who helped us to get the presentation launched, especially the support that we've had from within the division, within our committee, as well as the division as a whole. Please keep an eye out in your email inboxes with instructions on how to claim your CEs if you were interested in obtaining CEs for today's presentation. I will be sending emails based on the registration information included in the Sign Me Up. So if you, excuse me, if you have not signed up and you have any concerns, you can email me directly. My email address is darlene.whitaker@va.gov, and I believe it got sent out with all the advertising information. Please also keep us in mind if you're attending APA in Chicago in a few weeks. We hope you'll join the Diversity Committee for the open house. Again, that's going to be held on Thursday, August 8th at 7 p.m. local time, so that's Central Time, in the Division 18 hospitality space, which will be located in the Hyatt Regency McCormick Place. Okay, this concludes our initial webinar for the Division 18 Diversity Committee. Thank you all so much for those of you that attended. We will have this available hopefully within the next week online through our Division 18 website, and please keep an eye out in the future for any additional programming and webinars. We hope to offer much more in the future. Thank you.